Time now for News Talk. Patient advocate Dr. Stephen Cusin's live in studio now, and he's here to talk about your health. What happens when the doctor comes out and says, I don't know, you don't hear it a lot, but when you do hear it, it's a little unsettling.
The reason you don't hear it a lot is when the doctor has no definite answer. They'll pull out what's called MUPs, M-U-P-S, medically unknown problems, or trash can diagnosis. And that's not a good thing. Doctors don't always know what's wrong. There are far more symptoms than there are diseases. So
Sure.
A lot of people have symptoms with no problem. And yet doctors have a hard time saying we don't know, and patients have a hard time hearing it. And that's too bad, because patients deserve to know, want to know, should know. It is important. But 3/4 of the visits to general practitioners and family practitioners are for these MUPs, medically unknown problems. And if the doctor says they don't know and you trust the doctor, that's it. If it's really bothering you, or you don't trust the doctor, or feel that you want another opinion, then you go and get another opinion. If it's a belly pain, a GI guy like me. If it's a joint, a rheumatologist, an allergy, or an unknown skin rash, an allergist. But if that's all done, and they say they don't know, the trouble is the more tests you have, the more x-rays they do, the more consults you see, more and more and more. And it's a slippery slope. That's the name of my next book.
Well, and that's the other thing too, Doc, is when you talk about these kind of things and you go over and you don't find an answer, anxiety starts to set in.
And that is part of
That
the
can
physician's
add to
job.
your problems.
Yes, he who fears illness will be sick due to their fears.
This is true.
And the doctor's job is to say, look, I don't know what it is, but here's what it's not. It's not cancer, it's not infection, it's not inflammation, no organ damage is occurring. We'll keep an eye on it, but you got to relax with this. There's nothing that's going to harm or hurt you. And we'll keep an eye on it. And that's a nice thing for a patient to do, is to relax with it, go home, treat the symptom. If you have a rash, you treat it. If you have a bellyache, you treat it. You don't have to treat a disease every time you take a medication. And most things get better on their own. Most things don't have an answer. And sometimes, for example, if you went to India and you got traveler's diarrhea, and 3 years later you go to the doctor with irritable bowel, and diarrhea, and belly complaints, you're not going to remember that people who get infection when they're abroad often come back to the United States with years and years of GI problems long after the infection is gone. You don't know it, you don't remember it, you tell the doctor might not even know it either. Some things are known, but you'll never know it. Just this week, rosacea, the skin rash that people get on their face, it's been associated now for the first time with migraines, never was before.
Really?
So if you had rosacea 5 years ago, and you've been having migraines for a year, the doctor may say, well, did you have rosacea? Probably not. It's brand new. It's not yet well known. And, let's say you do know. The doctor says, well, did you have rosacea? And you say, yes, I did. He says, well, that's where the migraines are coming from. So what do we do for it? Nothing. No one knows where rosacea comes from, and there's no uniform diagnosis for migraines. Treatment, often without diagnosis. And that's, keeps the anxiety down. The level of intensive workups is diminished, because that's the slippery slope. When you demand an answer, there's got to be an answer. I want to know an answer. It's a legitimate feeling, but it's not a usual outcome. And frankly, if I go to a doctor someday, the doctor turns to me and says, well, we know what you got, that's not going to be a good day.
I hear you. The slippery slope it is, my friend.
Yes, good to see you.
We'll see you again next month. More news coming up after the break. Stay with us.
Head injuries can happen at any time and to anyone.
Mentalist is on.